Welcome to Keys to the Future. I'm your host, Gabby Coe. I've enjoyed a successful engineering career and want to inspire you to remain focused on your STEM education and career. Join me as I chat with amazing guests who are shaping the future and sharing their journeys to inspire yours. Ready to unlock your potential? Let's dive in. Today's guest draws on her career in global health to wrestle with the toughest public health and societal issues of our time, including the environment, pandemic preparedness, responsible technology, and mental health. She is a writer and public health specialist who combines her passion for women, technology, science, and the world to inspire women and girls through her writing. Her writing also draws on her over 20 years of work across more than 30 countries in Africa, Asia, and Latin America. She earned a doctoral degree in public health and policy from the London School of Hygiene and Tropical Medicine, and a master's in health science and international health from the Johns Hopkins School of Public Health. Please welcome Dr. Patricia Mechael.
Great. Thank you. It's great to be here with you, Gabby.
Thank you so much for sharing your knowledge and insights with the Keys to the Future community. Your journey has been so fascinating reading about it. So I'd love to hear a bit about your journey. What led you to a career in public health and specifically in digital health?
Yeah, so I was really quite fortunate in my early education experience. And in particular, I had a couple of high school teachers who really inspired me to pursue the career that I have now. One in particular, Dr. Gadabaku, who was a physics and chemistry teacher in high school, who, when I was getting ready to apply to a university, interviewed me. And she basically, asked me a series of questions. And when I finished responding to her questions, she said, "So it really sounds like you have this desire to be very global and you have this interest in health." She's like, "I could totally see you, working for the World Health Organization." And at that time, I was sort of like, the what organization? And I was 17 at the time. And so that really was the first seed that got planted for me around public health. And then it wasn't until I was an undergraduate at Johns Hopkins University and I was a pre-med student and an international relations major. And there was a Winter Institute class offered by the School of Public Health in international health. And I was like, okay, that sounds exactly like what I want to be doing with my life. And so this combination of the world and being global was really interesting to me, especially as my family immigrated to the United States from Egypt in the 1960s. And so I had that kind of dual citizenship perspective. And then at the same time was really interested in medicine and health and helping people. And so this felt like a really nice combination of interests for me.
Wow, that's amazing. You mentioned ever since high school you had this interest and your teachers were able to pick up on it. So it is important to speak to others, to tell them your interests and maybe get you help into what other resources are available that you can go and explore and be curious about.
Absolutely. Absolutely. And for me, I was a really quiet and like shy, like young person. And so I mean, I owe such a debt of gratitude to these teachers because they saw me even before I saw myself, and which was kind of great. Like I feel like I could have gone under the radar almost entirely. And I think we underestimate just like how incredible of a resource teachers can be. And sometimes they see us like even before we see ourselves, which is, I think, incredible.
Absolutely. And we should take advantage of that.
Mm.
You are recognized as a pioneer in the use of mobile and other technologies for health. And I'm really interested about this because you've been involved in award-winning digital health projects around the world. Could you tell us about some of the projects you're particularly passionate about?
Sure. Early on in my career, I spent the first few years working largely in different countries in sub-Saharan Africa where they did not have access to running water, electricity, or any form of like telecommunications. And so I got very interested in the potential of technology, particularly as like mobile phones were just starting to take off, and we were starting to see mobile phones in the general public and people were starting to like use them. At the same time, like the internet was starting to gain momentum. And so in the international development space, there was a lot of focus on the internet and the digital divide, but nobody was really talking about mobile phones as much. And having not had communication while like living and working in, these rural communities in Africa, I was like, well, what if people had mobile phones and they could mobilize access to like emergency transportation and health information and that sort of thing. And that's sort of like where I got my like interest in this like intersection of technology and health. And it was in the 2000s, so the early 2000s,
Mm,
so around 2000, 2001, when the mobile, penetration rates in most countries was around like 3%. So, you fast forward to where we are now, and we're in a whole other, technology ecosystem. And so a lot has happened, between then and now around, mobile applications that can help people take better care of their health and have a better sense of like where they are in terms of their fitness and wellness, in terms of nutrition, as well as for those who are suffering from different health conditions like diabetes, etc., that people are now have access to tools that can help them manage like their own health in very new and interesting ways. And for those living in, a lot of the low and middle income countries where I tend to spend most of my time working, it can be a real lifesaver. I'm involved in a lot of evaluations of digital health interventions, and we've seen where mobile technology is helping to improve maternal, newborn, and child health, where pregnant women are able to access information like during their pregnancies. They're able to have much more information and guidance to support their children to get the vaccinations when they're supposed to be getting their vaccinations in a timely fashion. We've seen incredible progress with the HIV pandemic in a lot of countries because of technology that is used to help people even do, self testing, the use of like self testing kits with applications that guide people through this process and then counsel people, enable them to access counseling that can then get them into different treatment programs. And then treatment programs that can send alerts and reminders to patients so that they know like when they should be taking their treatment. And so people are now able to live quite healthy, long lives with conditions like HIV because they have like both access to the necessary treatments, but then also resources through technology that can help them stay on top of their treatments.
absolutely. I mean, technology has revolutionized the way we live, play, and work. And now with the access, which is so important to have that access. If we don't have access to the technology, then we will be not doing very well in terms of managing what we do, how we exercise, what we intake, our health, guiding our health journey ourselves, not having to like say go to the doctor when we're almost at the cusp of having an illness that could have been prevented. So we can be proactive ourselves about how we manage our health as well. I think it's so important to have that access to the knowledge bases that can guide us, like you said, pregnant women in Africa guiding their own health, and then also guiding their children's health as well, so young, right? So I think that's very important and amazing that you have had all of those opportunities to really bring technology to where it wasn't before and making that impact. Wow, it's amazing. I really applaud that. So
Yeah.
you are also an author in your award-winning novel, The Antidote's Pollution Solution, which is a middle grade fiction collaboration with your son. is about a group of kids who stop a future pandemic. What inspired you to write this novel?
Sure. So I've been like a creative person slash sciencey person. And so I have these like two sides of my personality. And I started writing fiction, I want to say about 6, 7 years ago. And I always thought I was going to write these like international romance novels or something like that. But then I've found myself drawing much more heavily and getting like much closer to home in terms of the subject matter of my fiction writing. And so I find myself being much more interested in really leveraging my public health, my interest in science and technology in my fiction writing. And so I started with adult fiction actually, and then moved to YA. And then as I was working on a YA piece, pitched it at a writing conference, and then was told that there was just a lot more interest in middle grade, in like smart middle grade fiction. And so at the time, my son was 7. And so I was like, okay, I have this 7-year-old at home and inbuilt audience. And so let me try my hand at middle grade fiction. And so I started studying with some middle grade fiction writers and really trying to like learn and understand and what makes for really good engaging middle grade fiction. And at the same time, it was like the very beginning of the pandemic. And so my son and I were, kind of joking around, and I was like, oh, we wouldn't be in this mess if kids were in charge. And he was like, yeah, we wouldn't be in this mess if kids were in charge. And so we began this process and this journey to write this book together. And I still have pictures from that sort of like initial brainstorm where we mapped out the characters on post-its and the story on post-its, and put them up on the window. And he's like standing there, he's like 7 years old, and he's like pointing to the origins of this collaboration. And then he would get really into it. I mean, I sort of originally thought that he would be a good person to like read early drafts and give me feedback and all of that, but he was just much more opinionated about the story and about the characters. And then as I got to like more and more advanced drafts, we would read it together, and I knew that if he laughed at something, that I was getting it right, and that if he looked at me with sort of this like puzzled look of like, what are you talking about, that somehow I needed to go back and revise and rewrite whatever it was, because it just wasn't coming across the way that it needed to.
I really loved reading the novel. I think it encourages young people that are reading it or that who will read it to collaborate early on, right? Not just be in their own little silos, collaborate with others, which is so important because you exchange ideas and to be inclusive. In the novel, at first, there was one of the girls that wasn't really being brought into the team environment because different perceptions, and then also to let go of their own insecurities for the greater good. So I found it really fascinating, and I hope that a lot of kids at that age are reading it because it's going to really inspire them to not only seek out science and the STEM world, but also have that mindset of being collaborative and inclusive in how they approach their projects.
Yeah. And that was really important to me. I don't know what your experience has been, Gabby, but for me, it being a woman in the sciences, it is challenging. We do know that like attracts like. And so when you're in a largely male dominated field, that it's very easy for and not to engage with women in an effective way because they don't necessarily feel like the discrimination themselves, and so they're not necessarily like feeling that need to be inclusive, to have diversity, to engage with people who are not like them. And so I wanted the novel and just my writing in general to really get into more of that sort of like gender intentional focus and that gender focus.
Absolutely. And sometimes it may not be intentional. It's just the way that, people have operated and the mental model that people have. but we need to start changing that narrative to be more inclusive. And so we can start changing those mental models to not just work with the people that are just like us, but across all of the diversity that we have. So, and I know you already mentioned this, how you kind of got into your interest in public health, but what challenges have you faced in your career journey so far in this field, and how did you overcome these challenges?
There are a lot of women in public health, which is great. There are not a lot of women in public health leadership, however. And so there is this, it's so amazing that as you become more like you don't really appreciate it when you're sort of younger in your career because you are in this very supportive like field, this very supportive environment. And then as you get more senior and you get, as and for me, it was as I was getting more into leadership roles or executive leadership roles that you find yourself one of very few women. And in particular in the mobile health space and in the digital health space, like a lot of the early pioneers in mobile health were women. And so in the very early days, it was mostly women. And then as the field gained momentum and got very popular, it then got like incredibly male dominated. And so then there was this situation where I would be at an event with like 300 people and there would be four women in the audience, and I was either one of two women that were speaking in the entire event. And so I remember just like walking into these like environments and just being like, okay, this is crazy, that we're now in this like day and age and you can have this gap
Right.
in female representation. And we're now seeing some of the negative effects of that because as we're moving more and more into artificial intelligence, there's a real lack of women and female representation in data, in research studies. We know that they're in clinical trials that it's the most health related or medical clinical trials are largely focused on male subjects, which is leading to huge risk for women. You have the protocols for heart disease and prevention of heart disease are largely for men. And so a lot of women are now at increasing risk of heart disease because the protocols that have been developed have been based on studies of men. And so I think we need to overcome some of these like challenges. So we know that we need more women in leadership roles. We need more because things don't change unless women are in leadership roles. And we know, and the research is playing itself out too, that like health equity, health outcomes in general are much better when women are engaged. That things like in low and middle income countries, things like maternal education and maternal access to economic resources and just having even one or two women in leadership roles makes a huge difference. And so that is something that I've really started to take an active interest in and push towards is really this notion of like women in STEM, women in health, and becoming like even just much more visible myself. I'm an introvert, so I do have this like tendency to like very much prefer not to do public speaking or any of these things, but I've kind of like become emboldened to do more of it because of this sort of need to have people to become much more visible, but also to give role models to young women, who are earlier on in their career to kind of see that you can have a really, good career in these male dominated fields and to really try to encourage more of them to like push through some of the nonsense and the ridiculousness. I've been told things like I'm smarter than I look, that the backhanded compliments of like you're just like what does that even mean, like what am I supposed to take away from this statement? Yeah.
It's really interesting, and but I do agree with you though. We didn't have those role models for us. It's like, look at what she's doing. I want to be in that position someday. But now I think the tides are turning a little bit because we have people like us that are wanting to share the knowledge. that are wanting to like make sure that we're good role models and that we're uplifting other women into the roles that they can be because they do have that potential. We do have that potential, and bringing that diversity, it's just so key to having a solution that covers the other 50% of our world.
Absolutely, absolutely. I was recently talking to a colleague of mine around women's health issues and women's health solutions. There's very little that we know about important life altering situations like menopause. We don't talk enough about some of these some of these things, and the research is very limited in knowing exactly what works or how it works or why it works. I think we just need to have more conversations about these things and support more research that's focused on women's health issues, but then also include women in health research that impacts both men and women. And so I think that's like increasingly becoming clear that we have a problem and we need to start like figuring out how do we like fix this problem.
Right. It's something that we need to do together. It's not to exclude men, but it's like the togetherness part of it. It's the part I think it's so much more impactful because then
Absolutely.
otherwise we're not just
Absolutely.
addressing one data point. So I'm really curious, what drives you personally to keep innovating and leading in this space?
I love the field of public health. There's a really great definition of public health that it is like the science and the art of helping individuals and communities to like stay healthy. And so, there's so much about our culture and our society and our environment that impacts how well um we will do in terms of our navigation through life. And so much of life is about like health and well-being, and it's about our social lives. It's also about our mental health, our physical health, our emotional health. And so I'm passionate about this field of public health. Even as I've been doing, as I was saying earlier, like even as I've been getting more and more into fiction writing, I keep finding myself like going back to my like love of public health in my fiction writing. And then also too, I see that the technology is advancing quite quickly. And so there's a real opportunity to leverage it for the benefit of society and for the benefit of individuals. There's also some challenges that are coming with advancing technology, and it's introducing new harms and new challenges. And I think that also compels me to be more actively engaged in this field, is that I don't think that the general public in most countries or societies has a full appreciation for some of the negative effects that technology is having on particularly mental health and well-being. Young people are reducing their attention spans. There are new mental health issues among adolescent girls. There is increasing cyberbullying among adolescent boys. And so we are seeing some of these challenges like playing out in society. And I don't think people fully appreciate the extent to which we've become very dependent on technology and in many ways like addicted to it, and need to put it into perspective that there are a lot of benefits to being engaged in a technological world. We have to get much smarter about how we mitigate some of the negative effects of it.
Absolutely. Absolutely. You mentioned using technology to help us stay healthier, but there's also a limit. And where do we draw that line? Is like you said, society hasn't really appreciated that yet. But you mentioned physical health, social health, and they're also important for our overall health and our mental health. If we don't have those two, all those three rather, then how do we function? How can we function better and contribute to our society?
No, absolutely. And so it's becoming increasingly clear that we have and the research is also catching up with the technology, which I think is really important as well, that we now have research that is showing that, when technology is used by young people to connect with and reinforce relationships in the real world, that it can have incredibly positive effects on social and mental health and well-being. But it's when technology becomes a rabbit hole, like, right, where we get into these and we start interacting with people that we don't know, and strangers, and that people are commenting negative and positive on people's posts, and all of that then has these dopamine hits that impact young people in both positive and negative ways. And so I think it's just like really important to, to pay attention to the trends and the research that's out there, and to make it more accessible to like the general public. One of the things that I've seen as a public health professional that sort of straddles the academic world and the real world is that I think for too long, scientists have had this very sort of like ivory tower, big S science academic. And I think we need to almost like liberate science, and really focus on like the science of everyday life, that as human beings we are inherently scientific. We make science informed decisions on a regular basis, right? We're constantly running experiments in our day-to-day lives, etc. I think we've sort of had this, which is why I think we've seen this like backlash against science. And I think we need to kind of work together to overcome that, is to make science a lot more accessible, appreciated, etc. And so I think we're seeing technology offers an interesting opportunity to like liberate the science, unlock it out of like the ivory towers and bring it into people's like everyday lives. And I think it starts with young people who still are incredibly passionate. When you ask most kids what their favorite subject in school is, a lot of times a significant percentage will say science, and then we like lose something as they get older. They move their way through school and they start to lose that interest in science.
And that's unfortunate because it's interesting that you said we do science every day in our day-to-day life. And we're born as little scientists because from the moment that we're born, we're experimenting the world, learning about different things, touch, feel, hearing, seeing, everything. So all of that, it's a little bit of a scientific method, going on right throughout our lives. We need to really get more young people to stay in connected with the science as they grow up. And so that kind of brings me up to another point, because you're very passionate about this, women in STEM, and you kind of alluded to this a little bit. But you often speak about girls needing to be championed to pursue these STEM-based fields. And so, why is this so important to you?
My mom is a computer scientist, and so I grew up in a very supportive technology environment. As I've gotten older and I've seen the numbers, it is startling that we are losing ground with women and girls in STEM, and we do need more, just from like a problem solving in society perspective, right? Like if we want technology innovations and advancements in these areas, we definitely need more women to pursue these careers but then stay in them. And so we need like the conducive environment to keep people and in these fields. My son is constantly saying things to me like, "Mom, like, why is everything always about like girls and women and blah, blah, blah?" And I do feel like we do need to, back to what we were talking about earlier, is like we do need supportive boys and men. And we also need to support them as they
Right.
pursue science based careers, but also, encourage this need for diversity, that we do end up with much better results and much better innovation when we have all perspectives kind of brought. I also feel like it's like very lonely. Like I want
Mhm.
friends. Like it can be incredibly lonely, to pursue these, careers and fields. And I just want good company. I want there to be, more, more, people like me, or, who come at it from a slightly different perspective that
Hmm.
and give us much better outcomes as we go along. I do book talks with the Antidotes Pollution Solution in schools, and there's a male narrator and a female narrator, and they really do have to work themselves through the gender in technology and sciences and all of that, and often have young girls and young women come up to me afterward to express their appreciation because they don't see a lot of us out there. And so I'm constantly encouraging my colleagues to be much more visible because you never know when, there's going to be somebody in the audience. I recently had a young woman who is half Egyptian and she loves science, and she came up to me and she was like, "I'm half Egyptian and it's nice to see somebody who's Egyptian, who's a woman who
Right.
does STEM." And I was just kind of like, "Oh my gosh, like this is so specific." But you really never know when somebody is going to come up to you and say something to you and find inspiration in you just being there and sharing your story and all of.
Absolutely. I think the sharing of the story, our own personal stories, however we want to share it, it's very important because it can inspire somebody to go and just say, "Hey, I saw this person who kind of has my similar background. I'm going to go and research how to get to that field or whatever." I think it's so important to share that because people can start seeing themselves in those roles, in those positions, in that field, and if we don't share our challenges, because the journey is a journey, it's not going to be roses and everything, right? The journey is a journey. We need to share our successes so that they can see themselves in those positions, but also the challenges, to like say, hey, it's hard, it's not easy, but you can get through it. We did, right?
No,
So
absolutely. Absolutely. And to share the challenges too, to really be honest about those things, I think is also really important. Like I have even still now, like in the digital health field, it is incredibly male dominated. We're doing a lot more work, as an organization around gender intentional digital health. We're seeing that the gender digital divide is growing and that women are now more and more at risk of being left behind. And so we do have to do kind of like a lot more to overcome some of those challenges and barriers and engage, with male champions to support those processes. And it's not always easy. I facilitate a lot of workshops through Health Enabled around gender and digital health. And a lot of times male colleagues are like, I don't understand what the problem is. Like, I don't see the problem. And it's because they just don't have that lived experience. And I think as scientists, I think I've done this in the past where we sort of focus in on like being objective and distancing ourselves from lived experience. And as I get older and advance in my career in the sciences, I'm actually much more inclined to say no, like we need to be leaning into that lived experience because one, I think we get better science that way. Two, I also think it makes our ability to engage with society and with others much more meaningful, and to do that translational work of taking the science and like putting it out into the world.
so what do you think are the specific kind of skills or experiences that are essential for somebody looking to be in this field, in the public health, digital health field?
I think we definitely need more women in technology. I think we definitely need like women and girls to pursue technology careers. Largely, we're seeing the gender bias playing itself out with rapid artificial intelligence, right? And
Mm,
so take all of the biases that you have in technology, in data, and then just amplify those. And that's the thing that we're in right now. And so to me, I would, very strongly encourage like women and girls to pursue and hang on for dear life, even when it's really challenging, because our society will be better for it, particularly in technology. And it's not just computer scientists. It's not, you don't have to be a programmer. I think we need, design thinkers. I think we need, people that come at it from very different vantage points, and not just, the sort of hard technology. We need communication specialists. We need anthropologists that can help us understand the effects that technology is having on society and the way it's being adopted and absorbed into people's everyday lives. So I think really thinking creatively about where you could lean in, sort of given your particular interest or skills. It's not necessarily a science-based career that can have, a positive effect on domains like digital health. And oftentimes it's not necessarily just like the hardcore skills of computer programming or whatever. It's some of the other areas that are going to be more critical and more important. I get really like annoyed and angry when people talk about soft skills, and they talk about things like communication and interpersonal engagement skills and
Mhm.
design thinking as like soft skills, because I actually think they're superpowers. I think people often associate some of these skills with women and with being
Mm.
feminine and all of those things. And I think we need a lot more EQ and
Yes.
emotional intelligence in our world and in our lives. And I think we need to embrace that and appreciate that those are superpowers. They are not soft skills. Like anytime anybody says that, I get very angry and annoyed.
I can definitely understand that because, like, if we don't know how to communicate, how are we going to solve or, first of all, understand the problem and communicate it to others, right? Then trying to communicate a solution for it.
Correct. And that's what science is all about.
Hmm.
Science is really about, identifying challenges or problems, and then working our way through different approaches to understand it and then to address it. And yeah, and a lot of it is, is communication, is lived experience, those
Absolutely.
sorts of things.
Absolutely. So you're an award-winning author recognized globally for innovating technology to aid in healthcare. Before we wrap up, what's next for you? Are there any exciting projects in the horizon for you?
So there are kind of two big things. Right now in my fiction writing, I am working on a middle grade novel about a group of young people who are getting their first mobile phones, and they are having to navigate and really understand the technology ecosystem and become kind of like smart users of and critical thinkers around technology. One of them is a programmer, and he unleashes, a program called Cookie Monster that grabs his like friends like secret information and exposes it. And so, and they have to figure out how to get the genie back in the bottle. And it is like that, that is the way the technology ecosystem functions. And I don't think a lot of young people like know or appreciate that that's what is happening or what they're being exposed to. And so that's another collaboration that I'm working on with my son right now, and really excited about. And it ties in very closely to some of the work that I'm doing with Health Enabled. So I started Health Enabled about 10 years ago. I'm a co-founder and I'm the CEO, and we're increasingly doing work on what's called the digital determinants of health, technology in everyday life. How is technology, improving, societal health? How is it negatively impacting societal health, and what can we do about it? And I think, we need more and more, work and public engagement and education around some of these things. So right now, my fiction and my professional lives are
Merging.
converging on each other, and which is really exciting. I don't feel as like split personality where I'm just sort of like over here doing my fiction stuff, over here doing my my day-to-day job life. And so, which I think is really, I think that's like the sweet spot when you can bring all of these things and facets of oneself together in a meaningful and rich way.
Absolutely. That is amazing. It's really amazing. I thank you so much, Patricia, for sharing your journey and insights with the Keys to the Future community.
Thank you for having me, Gabby. I think, what you're doing is so important that we all need to spend more time kind of like reflecting on where we've come from and how so much of that are pieces of a puzzle that can then like drive us to a future that is like more meaningful and supportive, not just for ourselves and our own journeys, but then also for others. So thank you for having this podcast and having me on it. It's such an honor.
Well, thank you for your kind words.
And that's a wrap for today's episode. Don't forget to follow Keys to the Future on Apple Podcasts, Spotify, or wherever you listen to your podcasts for more inspiring stories and industry insights. Until then, keep innovating and stay curious.